And let me take your mic or unmute you. How do I do this? Let me see.
I got it.
Oh, there we go.
Woo!
I was telling, listen, I told them, I warned them tonight, Dr. Jew, that I was going to talk to them like I talk to my daughters. And
Mm-hmm.
that's the way you listen. You got to get that box together, okay? We cannot be out here on no level fives, okay? That's
Woo.
unacceptable.
So I was, first of all, nice to
Wait, let's
virtually
back
meet you.
up.
But can I just ask, where is your mother from? Because I said, my mom called it, you better go upstairs and hit the hot spots. She called it the hot spots.
The
If you don't
hot
have fun,
spots.
the hot spots. That's what she called it. I was like, okay, the box, I can see that.
Welcome, 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 Dr. Ju. Before we get going with you, I would like for this take a pause for the cause and allow you an opportunity to introduce yourself. Tell them who you are, this amazing, beautiful woman that is on the screen with me now. I'm so honored that you said yes to join me tonight on commentary. And I know you've been listening and you heard what we're talking about tonight, Dr. Ju. But I just want you to introduce yourself and just talk a little bit about you.
All righty. Well, again, I am Dr. Jew, and I actually hail from Pennsylvania. I have been, since the age of 18, I have been south, and I am in the metro Atlanta area. I went to Clark Atlanta University,
Whoop,
and
whoop.
before I um, decided to move forward and get my MD, I said, "Oh, let me take a break." But my parents both are educators, so I actually taught for a couple of years in the Atlanta public schools. So I
Wow.
put on my educator hat as well as my gynecology hat as a women's health specialist every day, all day in my exam room. So I am now, like I said, in Metro Atlanta, and I started a private practice 14 years ago. I have a partner now, Dr. Kathleen Johnson, who joined me just a few years ago. We do not deliver babies, and so we are all things women's health. We see patients
Wow.
in the office as well as take care of surgical needs when that arises. I am a busybody. I am married to Tim Burt. I have 6 children total. I
Yay.
always say I added the last two, but I'm privileged to be a bonus mom
Oh,
as
Miss
well as
Mom.
a bio mom at a very late age, but that's okay. And,
It
and
is.
so here I am, always ready to, share and, you know, bring everyone up to speed. The levels, I was like, okay, that's interesting. The levels. I may need to go to Chat GPT and say, create me a chart that I can use in
For
my
the
office
levels.
with the levels.
Well, let's just get right into it. I started off, Dr. Drew, with level one. I said, listen, level one is ideal. You just got out the shower, it's fresh, and it's no issues. And I told him, I said, we cool with levels 1 through 3.
Right.
It's levels 4 and 5 that concern me, Dr. Drew. And we could just talk a little bit of just historically about, because I was telling them about when I was growing up, my mother used to have that big old red douche bag in the bathroom. I never used to know what it was because she would never tell us. But when we got older, maybe in our teenage years, she would be
Hmm.
tell us
Hmm.
what it was for. And I was like, really? And then so once I started going to a gynecologist, she told me not to do that. She said, don't do that. Don't put that
Yes.
stuff up in there. So what do you say?
Okay. So it has changed over the generations. Yes, our mothers, our grandmothers, all would teach us. No different. But I think it was maybe the late 80s, early 90s when we recognized that oftentimes women can do more harm than good when they are dishing. There's bacteria everywhere on our bodies, on the outside, the vulva, inside the vagina, there's bacteria that is supposed to live there, but there are different species and different types of bacteria. What's in our mouth is not necessarily on our skin. What's on our skin is not in any other orifices, right? So in our anus versus our vaginas,
Mm-hmm.
and they should live separately. So when a woman dishes, the concern that we have is that you're pushing bacteria upward. The bacteria that is living below should stay below, and that is beyond the cervix needs to be different as well. And even I don't deliver babies anymore, but that's like a big issue. And the reason why it's so important for the cervix to stay tight when a woman is pregnant, and the amniotic fluid in the bag membranes to stay in, to stay put. Because if there is mixture, that bacteria can weaken the bag that's holding the baby and cause infection and cause problems.
Mm.
So we want to keep those areas separate as much as possible. And by dishing, you are probably going to have some intermixing and can actually cause a pelvic infection that way. So earlier, I heard you mention Dr. Mack's recommendation. I was like, yes, on point, because I tell, especially my younger patients, I know for whatever reason, this generation or our generation, I guess we're just so busy. Showers, when we were little girls, you did more bathtubs. You took
Mm-hmm.
some time to soak. And now, when it comes to our hygiene, I do worry that we are never soaking. And then it makes me think, and this is a part of the conversation, a lot of even younger girls are, when they are having their menstrual cycles, what do they use? They use things that, as I call it, plug them up. So tampons. And we know the vagina to be a self-cleaning oven. We've heard
Mm-hmm.
that. You've heard
Mm-hmm.
that, right?
I
It's a
have.
self-cleaning oven. But if I'm not letting things come down because I'm using something to plug up, when does it have time to actually do that? When is it breathing? So I
Ah.
tell my younger patients, I'm not telling you I'm anti tampon use or cup use. What I'm saying is, on your heavier days, you may want to use that. But then as it gets lighter, a panty liner. Let things
Yeah.
start
Let it
to
flow.
let it flow. And as Dr. Mack said earlier, get in a tub. She said once a week. I just beg them after the menses goes off, actually submerge yourself in a tub bath.
And what about things that people, I think someone said they used to put something in their tub. How do you feel about putting stuff in your bath water, oils and this and that and
You know, I think clean water is just best, and then use the soap. Put a nice candle if you want to have a scent.
have a zen?
Right, but because the problem with that is a lot of our products, they tilt our pH. The vagina is supposed to live in peace and harmony. All the organisms that are supposed to be there live in peace and harmony when the pH is right. And when you tilt that pH and it gets off, which what causes that? It's not just your Victoria's Secret or somebody's selling, what is it, the bath bombs.
Mm-hmm.
Um, now, I may purchase them and put them on the side of the sink for decoration, but I'm never dropping that in a
Me
tub
either. Me
like that.
either.
Never, ever, never. But, if you want the room, dim the lights and use a candle. But water, just clean water is best. So
Emma asks, what about Epsom salt? Would that throw your vagina pH balance off
it
or
can, yeah.
yeah?
And then we have to think about what stage of life, the audience members are in. So how a teenager's body is responding, and the vagina is responding to those pH balances is quite different than someone in their reproductive years. So from your teenage years up until your perimenopausal, and it changes again once you're postmenopausal. So the, prepubertal girl and the postmenopausal woman, the vaginal pH and the vaginal environment or the ecosystem are very similar. Why is that? Because in both of those stages of life, there is very low, if any, estrogen. And estrogen,
Ah,
we've heard a lot about in the news recently, right?
yeah.
But estrogen, without it, then the pH is different. The estrogen during the reproductive years is good for a lot of stuff we won't get into, but one thing it does is keep everything in peace and harmony, because of how it works with the epithelial cells. Those are the cells that line the vaginal canal. And that vaginal canal, because the pH is just right, it allows for the just right bacteria. There's a group of organisms called lactobacilli. And when you have lactobacilli, it produces lactic acid, it drives the pH down, and that is the harmonious environment that is necessary. When you lose that estrogen, the opposite is true. The pH can get driven upward. And not only the soap bombs and the Victoria's Secret body washes, what else throws it off? Blood, your menses, semen, right? Sometimes, oftentimes, women come to me because they maybe are in a new relationship and they go, wait a minute, something I know is off. And I'm like,
Something's off.
why? Why is it off? Because they noticed a smell.
Mm-hmm.
They notice a smell, and that smell with intercourse can be transient. It doesn't mean you got something. Now, if you got something, you got something. We're gonna test all the things now.
Mm-hmm.
But it is quite common that semen and blood, so after the menstrual period, women will notice a scent and if it is lingering, that is when you need to come see a gynecologist, or a women's health specialist, that
Mm-hmm.
you have a relationship with, so you could get in and not
Right.
try to make an appointment 4 weeks from now.
Right. That you need to be able to get in and get that thing seen, right?
Absolutely.
Listen, someone is asking, what are your thoughts about waxing and shaving down there? Are we supposed to keep the hair on down there, Dr. Jew, or nah? What's the hair for?
Hair does like one thing, just like eyebrows, eyelashes. It's trapping dirt, right? It just traps, the dirt and things that are flying like in our eyes, or when we're sweating. So I recommend, just at the very least, trimming. Shaving, waxing, going bald, that is such a personal decision
Mm-hmm.
that I don't get into that with my patients. But I will say to them, if the grooming, and doing, those hygienic, behaviors works for you, because sometimes, women bleed heavily, and they may have heavy periods where they're clotting, and they don't want that trapped, because it can cause, to the point of your episode this evening, smells.
Right.
So I have absolutely no problem. It's just you got to learn what works for you, because oftentimes women have, hormonal imbalances. They can have something called hidradenitis suppurativa, HS for short, and that can cause a whole different smell. And you don't want to do anything to cause infection by disrupting the skin, the integrity of the skin. So I'm not saying right or wrong. I'm saying necessary is not necessary. I can't necessarily say it's necessary,
Right.
but
Right.
if it's your choice to do, you need to do it safely.
Okay. I like that. Um, How often should a woman be seen by a gynecologist once they turn 50?
Oh, annually.
Still
And
annually?
annually.
What if you're not
Um,
sexually active? What if you
doesn't
just
matter.
doesn't
If
matter?
you it let me tell you, the only time that I tell a patient that they do not need to see me regularly, which for me, a well woman exam should be done annually.
Annually.
But a well woman exam includes a breast exam and a pelvic exam with or without a pap smear. For some
Mm,
reason, going to the gynecologist's office is equated only with pap smears. And people go,
right.
oh, I don't need a pap smear anymore, so I don't need to go. So the only time I tell one of my patients, like one of my patients came in today, she was, I was releasing her after 6 weeks after her hysterectomy. And I said, okay. She said, so when do I need to see you again? And I said, well, do you have a primary care physician? And if the answer for whomever it is says no, then I'm like, well, first of all, I need you to find one, but then I want to see you as well. But if that woman does have a PCP, I then ask, but does your doctor get you undressed? And if they go,
Mm,
well, no, they never do. I don't let him do that. Like that, then I'm going to share with her, I need to see you. I had a older woman tell me a week or so ago. She goes, "Oh no, my doctor does it all." I said, "Well, then I'll see you if I need to. No problem. I do. I have no problem with that
right.
if they are well versed in women's care, women's health care." But I caution. I say that with a lot of caution because, like, I know how to stay in my lane. Now, I may diagnose you with something, but I don't treat diabetes. I could tell you you're a diabetic, but I'm not going to treat your diabetes. I'm not going to treat
Right.
your hypertension, your high cholesterol. I'll do your labs and I'm going to tell you what I see. I'm going to stay in my lane. And why that's important, though I was trained in the basic, I know basic stuff. I know how to get a blood pressure down when I need to or start someone
Hmm.
on medication. But I graduated from residency 20 years ago, and truly things have changed and they keep changing. So you want someone who stays abreast of all the knowledge of that area. You don't want someone who was trained 20 years ago who still treats and practices from 20 years ago. You want someone who reads, they go to conferences, and they know the latest and greatest. I give you an example, and I know you're gonna talk about it. You mentioned it earlier about BV, right? Like bacterial vaginosis or trip. No, not even BV. I'm thinking of
Trichomonas.
trichom. I'm sorry. Just say trip. We say trip
Okay,
all the
trick.
time. Uh-huh. Trichomoniasis. Trichomoniasis
Oh.
is caused by trichomonads, right? The way we are to treat trick has changed. And if you graduated even 10 years ago and you're still treating patients, I promise you, most of those patients are going undertreated. So we used to give, that's why I said BB earlier, the medication is the same. Back in the day, we used to give you 4 of those pills. You took them all at one time, put it in your mouth, swallowed it. Ugh, it's
I
bitter
never
pill.
had that. I had that stuff called Metro Gel.
Metro, not for trick. I'm talking
Oh,
about BB. No, we're
oh,
talking for trick, not for BB.
okay. I must never
Metro
had
pill,
trick.
yeah,
Okay.
no, good. Treatable. You can get rid of it, but good. Um, but but now we treat both trick and BV the same. So
Oh.
4 pills has been out. It's not quite a decade. It's not a decade, but it's been out. So if you go to the emergency room or an urgent care or someone who again isn't staying up on the information, then you can be treated and still have the thing. So you want to change. You want to make sure that whomever you are seeing stays on it. So back to the whole PCP. I think by 50, because half of women, studies have shown for all the time I've been in medicine, that women, 50% of women only see a gynecologist. And I tell patients, well, that may be fine if you are low risk in every area of your life. Family history is low for everything: diabetes, high blood pressure, cholesterol, and cancers. But by 50, I definitely encourage my patients to seek care from both, so that I can stay in my lane and treat you appropriately,
Right.
and they can stay in your lane and their lane and definitely treat you appropriately. Even like blood pressure, what is an abnormal blood pressure has changed. Um, it just changed recently again. It changed, like, I think in 2019. It changed, just keeps changing. When we should get pap smears changes. What type of pap smears change. We
Hmm.
get recommendation or referrals from other offices all the time, and we kind of look at the pap result, and we could tell, like, they still treating patients like they back in residency in 1989 or even 2000. It has changed at least 4 times since I have been out practicing.
Wow.
Yeah.
Wow. Wow. And so if a person that, let's just say, so let's just use me for an example.
Mhm.
I think I'm considered menopause. I haven't had a period since 2023. Um,
Welcome to
but
Memphis.
so I'm 55, but I'm not, at the moment, I'm not sexually active, and I don't have a period anymore, but I still have all my stuff in there. I never had a hysterectomy or anything like that. So how often should I be getting a pap smear, or do I even need a pap smear? Listen, if I'm not sexually active and I'm not having a period, do I still need a pap smear?
So you still need to be seen annually.
Okay.
It is not about your activity
Okay,
that
because
you want
that's,
to be
I'm glad you said that, because I would always be like, well, I'm gonna go get my pap smear so I can make sure I don't have nothing.
right. But so here's the thing. I heard you in the first half hour. You kept going back to
I'm like, back
your
then,
former life. But let
right?
me tell you about the activity of that former life. Exposure is greater then because you had a younger cervix then. So acquiring certain STIs, one that most of us don't think about on a regular. We think about gonorrhea, chlamydia, and trich, but we don't think about the human papillomavirus,
HPV, yeah.
HPV, which we acquire typically earlier in life,
Back then.
back then. But it will impact you. It can impact you if you're not amongst the 70% of young women who clear their HPV within a short window, 18 months to 2 years. Your immune system will handle it. But if that's not you and it's lying dormant, sometimes when you go get a pap smear, and of course now we do paps along with HPV screening, right? And now there's newer ways, new modalities where there's primary HPV screening only and yada yada. I haven't adopted the new technique. I still want to see what it looks like, the cells, and I want to know if there's exposure to HPV. I
Hmm.
use that information for the patient's sake, both pieces of information. But if someone was exposed with HPV and did not clear it, it is still possible in your abstinent state for the HPV to get inside those cells and start causing havoc. And when they wreak havoc, that can lend itself to cervical, what we call dysplasia, which is abnormal growth, which later down the road becomes cervical cancer. So the recommendation now, beginning at the age of 30, is once every 5 years if you have both a PAP and an HPV. If you live in, a part of the country where there's lack of labs, resources, or whatnot, then a PAP once every 3 years, because we got to keep watching. And then HPV does not cause all the cervical cancers. There is another type of cervical cancer which is less common and less likely to be related to HPV. So I personally, I haven't there's just but a few patients that I've adopted for every 5 years. So if a woman has never had sex, like never been exposed, it is less likely that she should ever have HPV, right? She's
Okay.
never been exposed.
Right.
So my patients who are perhaps mentally challenged, disabled, and we know where they've been, there's been no prior history of any kind of molestation
Right.
or rape situation, then I'm not going to necessarily put her through it. First of all, not annually, but maybe every 2 to 3 years, we're going to do that pap smear. But we
Mm-hmm.
also, the reason why I say, you know, we want to work jointly. I want the primary care physician to stay in their lane and do medical stuff, medicine stuff. And I'm going to handle the women health part because of breast exams. The one thing about the reason why we teach and encourage women to do monthly breast self exams is so you can get used to the architecture of your own breast, right?
Mm-hmm.
But as gynecologists, like we see how many women a day, we've been doing this a whole lot, from medical school to
Yeah.
residency and into our practice. So our fingers are a bit trained to find at the time of a clinical breast exam. So that's why it's important
Okay.
to still be seen. Now, if you and your doctor make a decision that you're only going to come when hot flashes get really bad or when you're concerned about pelvic pain or if there's some bleeding that occurs, because understand, you have not had a period in 2 years. If you ever had bleeding, God forbid, if you ever had bleeding, do not call your sister girlfriend and say, girl, my period just came out, because that ain't what that is.
That ain't what that is after
That
all
is.
this. Right.
Okay.
Okay. I'm glad you said that. Now, let's go back because I can't even believe it. I've been on here an hour already. I want to go back to ask you what types of things, what are the possibilities when your VJJ does have a bad smell? And let's just talk about it from a perspective of sometimes it's a yeasty smell, like this cottage cheese like smell, but then sometimes it's that, oh,
Yeah.
what
Fish.
could
Yeah.
cause those things?
Hmm. Hmm. So great question. So that smells like yeast bread. Um, it could be yeast. Yeah.
Okay.
Right. So the candida, very common, especially when there's an alteration in the vaginal, not just the vaginal pH, but in the environment.
Mm-hmm.
So anytime, I'm not saying every time, but anytime you have taken antibiotics, it could be for dental work. In the back of your mind, you need to think, why am I starting to feel a little irritated? And you are more than welcome, if average risk patients can go and use one of the over-the-counter products that are out there for yeast. A fishy smell, however, like foul smelling, just fishy smell,
Mm-hmm.
you need to be seen. Now, I mentioned how sometimes you can have a mild fishy odor sometimes after menses or even after intercourse. But if that bad boy does not go away, then you need to go ahead and be seen. And transient, when I say transient, 3 days is not transient. I'm saying 3 hours. By the
Mm-hmm.
time you wake up in the morning, you notice it's changed, something like that. But if you're seeing something with it, definitely need to be seen. Sometimes there's blood itself can cause like a metallic smell. And that's possibly just
True.
blood or old blood, that kind of thing. But if you're smelling, may not be fishy, but it's foul. I don't know how to describe foul, but foul. Did something get trapped in there? Did you forget your tampon? Did I take it out last month? The last day? You
Mm.
need to think about that. Or when I use condoms, did the whole condom come out? Did you inspect it? Or did one get trapped? Or did a piece of it break off?
Mm.
You have to think about those things. And then there are other type of infections. Um, like one of the reasons why we tell women after they've delivered to abstain, right? Because things are very open. And
Mm-hmm.
if you're having intercourse, there may be some tears that go unnoticed at the time of delivery that have not healed, haven't had a chance to heal. Fistulas. Have you ever heard the term of a fistula? So a fistula is an abnormal channel between two orifices, between two organs, right? So the
Oh.
bladder to the vagina to the rectum. So
Ah.
that can cause an odor. There can be stool that is seeping through, urine that is seeping through.
Mm.
Um, After surgery, um, there could be a foul smell if the area was not healing properly, it's not closed properly, because oh my goodness, maybe that patient had an episode of BV unbeknownst to us. Remember this: when it comes to even BV and yeast and trick and gonorrhea and chlamydia, like all of the things,
Does those things stink too?
typically
Chlamydia?
now typically not. They can, but that's typically not a presenting sign. But what I wanted to say is this: everyone does not know when they have an STI. So when I offer, are you going to get STI testing today? Oh no, I 15 years and 20 years, and I'd be like, okay,
Yeah.
okay, you do you. But more than half of the time, for a lot of those, it's what we call asymptomatic, and you just test. Like I tell patients all the time, you get up on that scale and you don't want to do that either, but we make you get up on a
Yeah.
scale. So just test.
You have to lose.
Yeah.
You don't have anything to lose.
And I tell them it's not an indictment. I'm not talking
Right.
about your man, your relationship, your choices. I'm saying let's protect you. Let's get treated sooner rather than later. PID, pelvic inflammatory disease, um,
Mm.
can cause a smell. Anything that's dying, that has a necrotic smell, a dying smell, we call it necrosis, that definitely leave us. There's all kind of things.
So many
Like
things.
fibroids. Like fibroids. Like some
Hmm.
women have a procedure and the fibroids start to die off, right? And it's inside the cavity of the uterus. Oh, that causes a foul smell.
Wow. Now, can is it possible that if a woman is sleeping with a man, because it's her man, this is my man, we just together, like a husband or boyfriend, could his semen sometimes just not work with her body, and it doesn't mean that he's cheating, it just means that it's something that his system that just does is not working with the woman, and
Right.
they can't get it right because she keeps having an infection, and the smell keeps coming back.
Or the smell. Okay. So the good news, I was just talking to my partner about this the other day. I said, it's so sad that women have been asking for years, is there something I should do for my partner? And we have been answering for years. Science and studies have not shown that treating your partner is necessary. And guess what we just learned? We should treat the
We should
partners
treat
for
them.
women who have recurrent BV. So if
Mm-hmm.
you're having 3 episodes a year, that's recurrent.
Yeah, that's
And
a
by
lot.
the time, if you have one, it puts you at increased risk. And guess what? I don't know the breakdown of your audience members, but African American women, Hispanic women, Mexican women, we are at increased risk of BV, 10 times greater than non-Hispanic white women.
I wonder
And when
why.
you have BV, especially recurrent BV, it puts you at increased risk of acquiring and being not just exposed to, but acquiring STIs, HIV, right? Gonorrhea, chlamydia,
Yeah.
and trick, um, herpes simplex virus. So the treatment of it is important. Understanding what's normal and what's not, and getting treatment is definitely important. And now there's help even for those who have recurrences. And we have been telling you for years, because that's what the science told us to tell you. And now there's recognition that there possibly is help when both partners are treated. So definitely something for
Okay.
audience members
I
to
like
see.
that.
Mhm.
Now, I think this might be my last question. What about, are there, is is there something that you recommend for us women to do on a regular, consistent basis just to keep the box free from smells? Like, people be like, you need to eat some pineapples and then it's going to smell good down there. Or you need to eat these vaginal gummies because then it's going to make sure it's good and juicy and smell good down there. Do you have things that you recommend that women do on a regular basis to keep the box and the pH balance good?
Right. So I'm going to say it like this. I'm
Or
going to go
things
back
to
to,
stay away from, either or?
yeah. So I, the steams and the dishing and um, may, there's no evidence that those things work.
Hmm.
Even probiotics, taking probiotics. I tell patients, hey, you may want to consider probiotics because what's the harm in it? And most probiotics have a healthy amount, a good concentration of lactobacilli. But if someone is reproductive age, really don't expect her lactobacilli to be low anyhow.
Hmm.
But
Right.
if you're altering your pH because you are using so many different products, then that that can, of course, be a necessary thing. I don't know if you've heard of using boric acid suppositories. Boric acid, like what you put in a corner, you don't put it in your mouth. You put it
Right.
inside the vagina. Is a treatment. It's really for prevention more than treatment for recurring vaginitis,
Ah.
vaginal infections, because it helps to keep the pH. Oh yeah, there's tricks, but nothing better than what we always tell you: eat right, healthy diet, stay away from processed foods. And I heard you mention, I telling you, your mama and my mama, they were raised in the same. I was like ivory. I grew up on ivory. And then
Yes, ivory soap.
Dove was like, you have arrived. Oh, you
Hmm.
have
Right.
arrived. Yeah. But I would not necessarily use that in the hair bearing areas around the vagina. So in the vulva, the mons pubis above, especially if you're having issues with keeping your pH balance and
Hmm.
you're having recurrences, you may want to consider um, either using just water, which is really kind of a late stage thing. If these changes are not happening with like a feminine wash, and everybody's coming out with a feminine wash now. Really,
I know.
the idea is we don't want regular soaps to get inside. And that is why I again will recommend that if you are still menstruating, you're still having your monthly, then after the menses goes off, taking a bath, because oftentimes there may be debris. It could be tissue.
Hmm.
It could be products from the fibers in the pads or the tampons that get trapped. And again, because we use so many products that don't allow the blood to just flow out, we've lost the impact of the self cleaning oven. So it's just sitting in a tub of water
Hmm.
would be helpful. And I'm going to tell you, my mama, my 86-year-old mom, reminded me. I said, Mama, I'm going on tonight. She says, well, I remember my friend telling me, she had a friend that was older than her that said, when women go through menopause, their pH changes and so their odors change. And I said, yes, Mom, that is absolutely
Oh,
true.
oh Lord, help me. Tell me now. I'm in
Yeah,
menopause now.
right,
I'm
right,
not sexually active right now, but I plan to be in the future.
right. But the pH changes can cause a mild, it should not be something that's, just in your face, but you may notice changes. And the thing about women who sweat, right? People are working out, or even if they're not, we're getting hot and you're sweating because of the clothing that you have on. When you get home, take the underwear off. You don't need to sleep in underwear. You don't need to restrict yourself.
Yes,
Let
take them off.
everything
I've been telling people that. Don't sleep
let
with them on.
don't sleep with
Let the
them
box
on.
breathe.
Let it breathe. Absolutely. Absolutely. And I'm going to tell you what you said something earlier too, that I was just like giving snaps to about this is your body. So, you know, yeah, the person in the next booth in the restaurant may not want to hear that you use your fingers, but I don't, when my patients say, man, I put my finger up there, and they kind of, because I'm not your mama. I'm not about to paddle you
Right.
because you just told me you touched a body part.
Yeah,
Like,
it's yours.
I
I
don't
be
have,
wanting to know what it smell like down there
yeah.
and in there. So I go, I
And
smell it.
what most women have not done that I'm going to, recommend is getting a mirror and taking a look. Getting a mirror and taking a look. Because I will say this, there are times when my patients, you come in, you check in, and we send you to the restroom, right? And by the time you come out to see me, there's, I am saying 99% of the time, of course not, but a lot of times tissue just gets trapped. Or there could be some stool, there could be some wetness. People are unaware. They're just, we have a disadvantage that we have to take a mirror. Men can just stand in a, mirror in
Right.
the bathroom and look at their
Well,
genitalia.
unless they got a fuda. You know what a fuda is, Dr. Jew?
It's a fuda. Oh my God. Am
That
I ready?
upper dick area. If they got that, they can't see it. And the belly hang down too
That's just hanging.
far.
Right. Right. And they may need a mirror too. Mhm. So you get that mirror, ladies, and you look, because I promise you, what we most women don't do is even pull the hood of the clitoris back.
I've
That's
never
why I
done
say,
that.
yeah, that's, oh, well, if you are inactive and you are 55, ma'am, I need you to start. 50% of postmenopausal women can have what we call GSM, genital urinary syndrome of menopause, which can include the inability, because of all the thinning, because of the lack of estrogen, the thinning of the tissue. um, you can get agglutination. You can get where the hood won't retract easily. And then somebody may need to go in there and break up a little bit of scar tissue. So,
Oh,
yeah.
okay. All right. Well, I'm glad you told me that. Before we end this, I want to go through some of the questions because I want to
Sure.
make sure that the audience gets some of their questions answered. Let's see. What about powder down there? Is it safe to put powder down in the vagina area?
I'm going to say no.
Okay.
Remember, there's, class action lawsuits right now regarding very famous powder that probably your mama and my mama told us to use. And the concern around ovarian cancer. Um, but I don't think I think do what we share and leave the powder out.
Okay. Someone says, is it washcloth to clean down there? Yes or no? Because, I've heard back and forth about this, don't use a washcloth, just use your hand and some soap. I don't use a washcloth to wash my VJJ. I use soap with my hand and I use my washcloth for everything else. But some people do. So what do you say?
Yeah,
Washcloth to clean
separate,
down there? Yes or no?
just separate washcloth versus the rest of your body.
Okay. Separate washcloth versus the rest of your body. Let's
And can I
see.
say before I forget, in case no one asks,
Yes.
because I no longer assume that people know that when they finish using the restroom for one and two, that they're supposed to wipe from front to back.
Front to back. So you go down this way, right?
You go,
Go.
are you going like, well,
Well,
if you're
if I'm sitting down, I'm gonna go from the top part of my vajayjay, and then I'm gonna go down
towards the back, yeah,
towards the back. And then if I'm doing it number two, I'm gonna go the other way. I'm gonna go that way, then up. right?
Because you're going behind yourself.
Behind
You
myself,
confusing me. Yeah.
and you
Always
gotta,
start from the top. So start from the urethra where you urinate from and move backwards.
and go back. Right.
Never do it the people say the easy way. When you're 3 years old and you're learning how to even get potty trained, it's natural because the hand moving this way is
Right.
easier. You have to train young girls because that if you're moving from the anal region upward past the vagina and to the urethra, you're increasing risk for infection, namely urinary tract infection. If you look up, like, I don't want to assume everyone's had a UTI, urinary tract infection, but when you look at the what grows out, right? We send a culture off oftentimes, and the bacteria that grows in the urethra or grows out of the urine sample from the urethra are bacteria that live in the anus. And then as you
Mm,
age, again, part of what's happening, loss of estrogen, loss of the elastin, collagen, and the structures, you get a decrease in the space. So now the anus is closer to the urethra. So it's easier for the bacteria to transfer. And I remind patients often that sex is dirty business. You got the lights off and you're trying to find the right hole. Sometimes
and
people
sometimes
miss.
he bump up in the wrong hole. He bump up like, hey, 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 wait a minute. But
Yeah.
now you don't already touched it. Now you don't already
And
put
you're
the.
dragging
Now you're going
back.
back into the.
Yes, ma'am.
Yeah, but you know how they do. You know, in the heat of the moment, you don't be like, well, wait a minute now. Let's go
Right.
wash that off.
Wash. Exactly. Wash it off. And getting up afterwards and urinating can help decrease the UTIs. Just
Okay.
let that to let
I
it flush
love
out.
that. I love that. I love that. Dr. Max says, yes, use separate washcloth. Yes, Dr. Max says feces E. coli bacteria can get into the VJJ. Call, yes, yes. Okay. This was so good. Dr. Ju, I'm so, so happy that you joined me tonight. This was fun. It was educational. And it was just good, and we had a lot of interaction. Anal sex, then VJJ. Oh, look. Yes, that's what can cause it. Listen, you can't go in there and then go in there. That's a no, 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 no. What they say?
Right.
No, 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 no. Yeah, yeah, no. It's a no, 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 no. No.
Yeah.
Okay. Ladies, we have given you lots of tips tonight of how to keep the vajayjay good. We want to keep it at the level 1 smell as often as possible. Men, if you smell the wharf down there, don't go in because you're just making it a bad situation worse. Okay. Don't do it. And I had someone on here earlier, Dr. Ju, asking because she said she just moved to Georgia and she would like to know where you practice so that
Oh,
she can be one of your new patients. Are you accepting new patients?
yes, we are accepting new patients. If you go to our website, www.radiantwomenshealth.com, and then you can fill out, you'll click the button that says become a patient, and we will call you after you fill that out.
Yay. Okay, can you repeat that website one more time?
My practice name is Radiant Women's Health. So radiantwomenshealth.com. And if you're interested, um, just fill out the information and you will receive a call.
Thank you, Dr. Ju, so much. Nova says this was very necessary. Everyone, thank you for putting that. Candy put the website in the comments. Thank you so much for doing that. Dr. Mack, thank you so much for the connection and for being engaged with us tonight. Thank all of you all who tuned in. It was many of you all on here tonight. I could not keep up with all the comments, but I promise I will get back to the comments and any questions that you have, follow-up questions you have for Dr. Ju, I will make sure she gets your questions and she will get you will get back to them as best she can.
Yeah.
It makes let's see, it makes you my Coochie, and yeah, I'm getting too old to have sex. Okay, well, I'm sorry. I told my mother, I said, well, Mom, when I'm in my 80s, I'm gonna still want to do it. She's just like, I don't know.
Well, I mean, I have them. I do not assume at all. I always ask patients, are you currently sexually active? And sometimes the next question is with yourself. Sometimes it's by yourself. So
Yeah,
doing that is important to keep things right, loosey
but
goosey.
it's 80-year-old women who still be doing it.
Yes,
Really? So my
yes,
box gonna still work in my 80s?
yes. And
Okay.
you need to make sure of it and do your part to keep
Right,
it
take care
right.
of it. All
Yes,
right,
I
Dr.
do.
Drew, this was so fun. I would love to, you know what? I would love to do another segment maybe next month because there's so many things to talk about. Like I want to talk about, I have so many friends who are going through endometriosis, fibromyalgia. Like I just want to understand some of the other things that can happen with the female reproductive system and all the things down there. So just like I'm doing with Dr. Mack, I'd love to have you come back, for another segment maybe next month and we talk about something different.
Sounds good.
So, sounds good.
Uh-huh.
Thank you so
Thank
much.
you. Thank you for having
Y'all
me.
have a good night. I will keep this will be up on my Facebook page as well as my commentary YouTube channel. And someone said, "Oh, 80 years old. I hope my box is still working at 80." Me too. We got to take care of
That's
it though.
another
Okay?
conversation. We're gonna have that
We got to
conversation.
listen to what Dr. Jew has told us and take care of it. Okay, y'all?
Yes,
All right.
yes.
All
That's
right.
another
Y'all have a
segment.
good night. I'll see y'all next
Yeah.
Wednesday at 9 p.m. for another episode of Commentary. Okay. All right. I love y'all. Thank you so much, Dr. Jew. This was fun. Good
Thank
night.
you. Bye.
All right. Yeah.